Hi guys, welcome to join Adjei-Cobbiah on today's session. In this video, we are talking about giving health education and nutrition at the antenatal clinic. It's very important to talk about nutrition in pregnancy because deficiency in pregnancy causes a whole lot of complications such as anemia, intrauterine growth restriction, and sometimes abortion, and these are the things we want to avoid. Okay. So when you want to give health education in pregnancy, always remember that you need to first talk about the antenatal care. When you tell clients about the importance of antenatal clinic, some activities that are done at the antenatal clinic, such as lab investigation, taking ultrasound scan, and monitoring fetal and maternal well-being. Okay. Now, because you want education or learning to be effective, it's very important to start from what clients know to build up on it. So you want to find out from clients what her eating habit is. Again, you also want to find out the food available in her neighborhood so that you could make example from those and again, foods available. Okay. Then you also want to find out from clients if she has any food taboos or any allergies to any kind of food. Afterwards, you tell the clients about the food groups that we have. Okay. According to the components, the three main food groups you're going to talk about is the energy-giving food, the protective food, and finally the body-building food. Because you need to use the maternal and health record book, the new one, which you open to page 17, you have these 4-star diets. And these 4-star diets are labeled the staples, which is also known as the energy-giving foods. Okay. Then we have the seeds and legumes that comes into the bodybuilding part. They also have proteins. The proteins include meat, dairy, eggs. Okay. Then finally we have the fruits and vegetables. So let's say the energy-giving food. So the energy-giving food, as I said earlier, is the staples: cassava, plantain, maize, rice, and you need to tell the client what these are. It gives the energy for the client to meet the increased metabolic rates that happens because of the pregnancy. Okay, it gives us the energy to also go through their daily activities as well. Then you move to the protective food. So basically, protective food are vegetables and fruits. Okay, example: oranges, tomatoes, watermelon. And it's also prudent that as you use the maternal health record, you allow clients to identify the food groups or the type of food stuff she sees. It makes us think better. Okay, so the protective food gives us what increase our immunity or helps us prevent and fight diseases. We know that pregnancy reduces the pregnant woman's immunity, and pregnant women are prone to infections. So it's very important that they incorporate fruits and vegetables in their diet to help them fight disease. Again, foods that are rich in vitamin C help in iron absorption, and this prevents anemia. It also helps to boost our immunity, as I said earlier. Then finally, we come to the bodybuilding foods. These bodybuilding foods are basically proteins, and these proteins are needed for protein synthesis. Mind you, the fetus is developing. The cells are undergoing protein synthesis, and we need these proteins to help in the process. Okay, so mothers are supposed to be encouraged to incorporate these in their diet. Remember to tell the client that it's very important to make sure that their diet has both frequency and variety. So by frequency, if you're a pregnant woman that before pregnancy you were taking twice or eating twice a day, you need to add 1 extra meal. If you're eating 3 times, you need to add 1 extra meal. And also, the extra meal can be snacks. Okay. Then the variety in the sense that we have to vary the food stuff so that we get different types of nutrients from our food, as we mentioned earlier on. Also, mind you to tell the client the need to ensure adequate nutrition and diet in their daily activities as well. Then, tell the client about pica. So pica is craving for non-nutritive materials, and these are common in pregnancies, especially for women that are unmarried. Okay, now we need to understand that craving for non-nutritive material, example, something called sugar is a clay. does not provide any nutritional need, and rather expose the woman to being exposed to worm infestation that could cause chronic anemia by leading to chronic blood loss from the intestines. Okay, rather clients should replace them with good snacks. Okay, then pregnancy comes with vomiting and nausea. However, pregnant women are not supposed to experience excessive vomiting. Remember to tell the client during the nutrition education that excessive vomiting should be picked up and reported to the antenatal clinic immediately, even when the appointment is not due. Again, remember to tell the client that alcohol and smoking are prohibited in pregnancy, especially for people that are secondary smokers. And secondary smokers are people that do not directly smoke, but they are within the environment that an individual is being a smoker. So they get exposed to the nicotine. This nicotine can cause vasoconstriction, reducing the blood supply to the placenta. And we know that is going to cause nutritional deficiency and more intrauterine growth restriction. Very, very important. Remember to also tell the client to avoid caffeinated drinks, okay? Drinks or tea that contains caffeine, they also sometimes raise the blood pressure and also causes nutritional deficiency, reducing the also blood supply to the placenta. Now, when you get to this point, remember to also ask the client or find out the socioeconomic status of the client, okay? Because we want to find out if for some reason the occupation of the client prevents her from taking break to take in some food, okay? Mind you, we spoke about frequency of the nutrition, okay? Then we also want to find out if client is able to afford some food groups. When we started education, we mentioned that we need to find out the locally available foods and within client's range. So when you also find out the socioeconomic stage, you give an example that the client has access to, the client can afford. Okay. So when you're giving fruits examples, you don't tell client that madam you need to take grapes. These are expensive, okay. But she could replace with a much cheaper options. I hope you get it. Yes. Now you also have to talk about nausea and vomiting. As I said, the woman should not vomit excessively. If there's excessive vomiting, there would not be enough for absorption of the nutrients that she's been able to incorporate. And also, because pregnancy comes with increased risk of constipation as a result of the action of progesterone on the intestinal muscle, reducing peristaltic movement and causing constipation. Remember to tell pregnant women to take in adequate fluid and also food that are rich in both fiber and beverage. Example, unpolished rice, wheat, cabbage, and even the chaff from oranges. These are going to help reduce the incidence of constipation in pregnant women. Okay. Now, give your client a chance to ask any question that she has and emphasize on the importance of adequate nutrition in pregnancy. If the client has no other questions, remember to ask her one or two things of what you told her. If she's able to answer, congratulate your client, thank her, and document it. Until then, it's a bye.